For months of outstanding work by the Planned Parenthood Federation of the Americas, resulting in the development of a strategic plan for fast-tracking the implementation of integrated youth-friendly services within our country's primary healthcare development system. We would like to congratulate the PPG2 for this novel development, the National Primary Healthcare Development Agency, and the Federal Ministry of Health for providing the enabling platforms under which the strategic developments took place. For us at the Ford Foundation, launching a strategic plan is only the beginning in efforts to tackle the nagging inadequacy and unpreparedness of our healthcare system to address the mounting health problems of our young people. Youth contribute enormously to the burden of population and ill health in this country. They account for more than 60%. Those aged less than 30 years account for more than 60% of our population. And they also account for high risks of morbidity and mortality. And youth involvement in maternal and other types of mortality account for our current inability to meet or to attain the Millennium Development Goals. I believe that going forward, the intensity and tenacity with which this strategic plan is implemented by all stakeholders will determine its potentials in fast-tracking the health and development goals of our country. Surely, primary health care, which is the foundation of our healthcare delivery system, provides a unique opportunity to counsel and to provide simple, curative, and preventive healthcare services to our young people. Because PSCs are located in places closest to where majority of Nigerians live, this integrative approach is one of the most effective ways to ensure that the most vulnerable and hard-to-reach youths have access to evidence-based health services. I would therefore like to take this opportunity to call on governments at all levels, in particular the states and local government councils, to use this strategic plan to map out policies and programs for improving young people's health, in particular their sexual and reproductive health in their various domains. The Ford Foundation is committed, both in Lagos as well as in the New York office, to catalyze this process through capacity building and technical assistance support for scaling up the adoption and use of the strategic framework throughout the country. We believe that this is a very important and solid needed approach for building the competencies of Nigeria's healthcare system to address the health and development challenges of our young people. Once again, ladies and gentlemen, I congratulate the Planned Parenthood Federation.
And the MPCD, in its wisdom, have set up the PAC system, which is like 33,000 over across the country, which is a preparation. And then we have an opportunity of the youth population, which is a third of the population, needing services that are provided by these people. And so what the guideline is doing for us here is to bring the preparation that has been done by the ministry through the support from the government of Nigeria to meet the opportunity that the youth population presents. The document lays a 3-year action plan that includes measures that ensure good governance and management. And perhaps most importantly, it calls for direct youth involvement to ensure that young persons have a voice in shaping the care that they receive from these centers. I am proud to be part of this launch because these guidelines offer a smart solution. By my own definition, I think it's a very smart solution to addressing the fears, the stigmas, and other barriers preventing youths from walking into the PAC center to receive services. The guideline ensures that when the adolescents and the youth walk into the primary health care center, the PHC facility itself is prepared with the staff, the skills, the educational tools, and the supplies to meet their peculiar needs. We believe that the scale-up of this integration will be cost-effective and will allow improved access to sexual and reproductive health care for young Nigerians. At Planned Parenthood Federation, we strive for the healthiest generation ever and work to create an enabling environment that empowers the next generation to lead healthy and productive lives, no matter what. No matter what here means, no matter the barriers, no matter the stigma, no matter the fear, no matter the financial constraint, no matter the difficulty in geographic location and even access, we will provide services to ensure that we have the healthiest generation in the next group of people that are coming. And that is what drives our interest to work with youth. These guidelines are an important step in achieving this goal. Thank you very much.
NFPA would be willing to partner with you in stepping it down. The one thing is to have launched the book. The next level is to step it down and train as many health workers as possible in being able to use the documents. In moving forward, UNFPA is willing to partner with the Federal Ministry of Health to do that. And I think besides that, I think that the next thing we also should do as development workers is also to, besides the fact that we've done this, it's also to create the demand and remove all those roadblocks that makes it very difficult for young people to access services. We know that having services available at primary health care is very important. But it's also important to work with young people to be able to create demand.
I want to congratulate the ministry for making today a reality. Indeed, the last 3 years have witnessed tremendous progress in the country, and we cannot but continue to thank the ministry for the wonderful support we have had. Let me say, ladies and gentlemen, that if this is going to go forward, it's going to rest squarely on the shoulders of National Farmer Market Development Agency, and I'm sure that you have had very passionately Dr. Mohammed as he spoke. And I want to congratulate you, sir, and your agency, and we trust that you'll be able to accomplish this. I also want to congratulate the Planned Parenthood Global and the Ford Foundation with your partner, and indeed everyone who has contributed. Perhaps the greatest congratulations will go to the young people of our country.
Thank you. That's my mom that said already come. She's not come out. She's loved my mom, and told me that I'm too small for that kind of person. Hey, where did this come from? As for me, I don't know where this come from. Let me tell you, from the mouth. From the mouth? Yes, this small mouth. Yes. You promised to baby. Yeah. It's very easy. Very no. Hey, it's not my food. Listen to your children. There and they just them. How my daughter says that they welcome back from school. No, my daughter back from the school. They say they are coming from home. Come now. She's my friend who told me that this is come out from the mountain. Big no. Is this not the same question I asked you yesterday? You still went and then I asked your friend in school where this come out from. I want to come in this house. You are too small to make when you grow, you will know.
I want to say now, what is it? Why are you eating there now?
Because can you imagine that General come back from teaching afternoon and told me that baby come out from the man. I find the school don't have.
Wait, that same question yesterday?
Yes.
You are very stupid. I'm going to stop asking such questions. You are too young. Look at you. Look to men like you. What do you know? I'm going to change you from that school. What did you say now? Look at you asking that women used to come out from. Yesterday, she repeated. Would you tell her the truth? How can I tell her? She's too small. You never tell her. You don't tell her. Look at her. Little girl like this. You never tell her. Still us in this house. Tell her the truth. I will tell you. You better tell her.
they always ask me to go out with my mom to leave, I always go to this thing. You see, actually, because love my mom and told me that I'm too small for all that kind of thing. You see, very, very, very much.